AICR has for years been focused on prevention, dietary factors, exercise, just all sorts of behavioral, lifestyle ways to live that can help to prevent cancer. And of course, you'd rather prevent it rather than treat it. We had several years, 3 or 4 years of funding from AICR. It was a collaborative study with the California Walnut Commission. And we did work that would have been very difficult to fund through the NIH, using natural products to prevent colon cancer. And this funding let us go off in a very, very new direction for our laboratory at the time. So we published a paper about 2 years ago in which we looked at the effect of walnut consumption on colon cancer in an experimental mouse model. And what we were able to do with this funding was actually embark on a whole microbiome analysis. We were fortunate that where I am at the University of Connecticut, the Jackson Laboratories had recently opened up a genomics institute right on our campus. And one of the world's sort of premier experts in the microbiome, George Weinstock, had just joined. And so George and I started a project with a junior faculty in my lab, Masako Nakanishi, to look at how walnut consumption affected the microbiome in this experimental mouse model and how it may play a role in cancer prevention. And we published a study showing that consumption of walnut actually had a prebiotic effect where it actually changed the community structure of the microbiome in what we believe is a positive way to actually most likely, of course we haven't proven that yet, but most likely contribute to protection against colorectal cancer, at least in male mice in this study. Since then, we have a study that's almost finished, we haven't published it yet, where we're looking at the impact of walnut consumption on ulcerative colitis, which is a huge disease problem in the United States. There's over 1.5 million cases a year. And what we found is that consumption of walnuts seemed to limit the amount of ulceration in an experimental mouse model of ulcerative colitis. So we're pretty excited about that. We collect, to translate that to human, we do collect a lot of demographic and food frequency data on patients that come. I run a colon cancer prevention program. And so we've looked at probably hundreds and hundreds of patients over the last decade.